So we're ready to look at some of the SpiraBrush samples under the microscope. So by this point, the physician took the sample from the woman with the SpiraBrush. There was, of course, no bleeding or pain, and decapitated the SpiraBrush head into the fixative jar where it went to the laboratory, and the laboratorians straightened out the SpiraBrush, scraped it onto a piece of filter paper, and then processed it just as we process an endocervical curetting. The sample then gets cut into various levels, and what we're about to look at is one of those samples under the microscope. And this is the image that we can see using a 2x objective. And you can see that there are abundant pieces of epithelium scattered amongst blood and cervical mucus. And from this very low power, all we can appreciate is how cellular fragments are admixed with the more acellular mucus, as well as the blood clots or the fibrin clots. So to really take advantage of the sample, we'll go to a slightly higher magnification. And with SpiraBrush samples, I always recommend scanning them at a 4x objective or a 40x magnification, because it's a little trickier than a cervical biopsy. The fragments are admixed randomly and not placed in any particular order. So I usually scan the slide as I go up and down and identify fragments of epithelium such as this one, that we can slightly and very quickly go to higher magnification and identify. And that turned out to be a piece of mucus. So we can be fooled at a lower power. However, here we have a piece of endocervical tissue with endocervical glands. We'll take a brief look at that. And we can see how beautiful the histology is, giving us perfect cohesion of the endocervical fragments and looking at the perfectly normal endocervical glands. Again, there's one layer of cells lining these glands. There's no concern at all about nuclear atypia. This is just a normal piece of endocervix. Scanning at the same power, right next to it, we see a piece of squamous epithelium. And that piece, even at this magnification, has very prominent nuclei. And of course, we need to examine that at a higher magnification. And here comes the 10x objective, 100x power. And even at this magnification, we can see that some of the nuclei are large, irregular, and we have binucleated forms. As we go into a higher magnification, it is very easy to see right in the center of the field the large binucleated cell with irregular nuclear borders. The cell size is that of a normal superficial or intermediate cell, and this is a fragment of epithelium that is diagnostic of a CIN1. A very nice piece of epithelium. And in this SpiraBrush sample, we can find that piece of epithelium that is diagnostic, and as we scan along, we can find another smaller piece right over here that is also diagnostic. It's smaller, but the nuclei are quite large and irregular, and again showing the same coilocytic cytoplasmic clearing. And as we continue to scan, we see other pieces of squamous involved and not involved. So here's another piece that appears to be involved, and we'll go in and scan that at a higher magnification, and you can see those beautiful binucleated cells here demonstrating diagnostic CIN1. So this is a very nice and abundant sample of a CIN1 lesion. We will now switch over, and we'll go from the CIN1 to the other end of the spectrum, the high-grade lesion of the cervix. And again, we'll start with a 2x magnification just to scan the cellularity of the sample. And you can see here in the microscopic field abundant fragments of squamous epithelium. And in this instance, in this particular sample, the fragments are quite, even at 2x, quite hyperchromatic and very strikingly prominent in the field. So the mucus is light pink, and the diagnostic fragments of epithelium are quite dark and purple. And of course, this immediately merits examination under higher power, and we will go and do that. Here's our 4X. Again, the 4X demonstrates how highly cellular the pieces of squamous epithelium are. We'll go slightly higher to 10X. That is our highly cellular piece of squamous epithelium. And I'm just going to move over and contrast it to a piece of endocervix. And you can see that the endocervix is comparatively much less hyperchromatic, and that's because the nuclei on the glands are single-lined. A little bit of inflammatory cells gives it more color, but essentially this endocervix is quite normal. That is in comparison to the pieces of squamous epithelium, which are quite hyperchromatic, very hypercellular, and as we examine it at 200x using the 20x objective, we can see that the nuclei are markedly enlarged. The cells are quite small, which means that the nuclei are very close to each other. If we go slightly higher, we can see that the nuclei have an irregular contour, and right in the center of the field, I'm placing a mitotic figure, which again supports the diagnosis of a high-grade cervical cancer precursor. In this instance, we can feel very comfortable in saying that this is CIN3. The cells are all very, very small, very high nuclear to cytoplasmic ratio. The presence of mitotic figures practically assures a diagnosis of CIN3. Other fragments present in the sample may indicate slightly lower lesion. So this fragment right here has some cytoplasmic enlargement near the surface on one side. If we had only this field to look at, one might consider diagnosing this as a CIN2 rather than a CIN3. However, as with a cervical biopsy, in our laboratory, we usually give the diagnosis of the highest degree of cervical intraepithelial neoplasia, and in this instance, that would be a CIN3. Notice how in this particular fragment, the basement membrane is quite orientable, so that the basement membrane is to the left with a row of parabasal cells, while the surface of the lesion is to the right with more parakeratotic differentiation. And notice that mitotic figures are running pretty much to the upper third of this particular epithelial fragment. As we scan this sample, you can see that there are numerous fragments, and not all SpiraBrush samples are this abundant, but as physicians gain expertise with their samples and become aware that the patient really does not feel discomfort while they're brushing their lesions, the samples such as this one are quite common, and in our laboratory we get quite a few samples of CIN3 that are this abundant or even more abundant. Again, the samples can be, and if you have quite a few fragments, will generally be orientable. The piece of in the middle here showing a nice parabasal row. As we progress towards the middle of this lesion, you can see the more parakeratotic surface, and in this instance there's no question that the nuclei at the surface are very large, very high NC ratio, and diagnostic of a CIN3.